Hello students, welcome to part 3 of the renal urinary assessment chapter. So now let's focus on physical assessment. So we have to check on general appearance, review of body system, right? But also the skin is important because can show you edema associated with kidney disease, especially in the pedal, in the foot, pretibial, in the shin, and sacral tissues and around the eyes. That's important. You have to use your stethoscope to listen to the lungs to determine whether the fluid is present. So fluid edema is an important assessment in this chapter. Assessment of the kidney, ureters, and bladders. To assess the kidneys, ureter, and bladders during an abdominal assessment. Auscultate before percussion and palpation because these activities can alter bowel sounds and obscure abdominal vascular sounds. So now, nursing safety priority alert. Performing palpation on a patient with a suspected abdominal tumor or aneurysm may harm the patient. Okay, so here you have the picture how you have to do your advanced technique for palpation of the kidneys. You put your hands under the side of the waist, right, and you can assess, but this is something that for me has to be done by a provider. Assessment of the urethra, record the presence of lesions, rashes, or other abnormalities of the penis or scrotum or of the labia or vaginal opening. Urethral irritation is suspected when the patient reports discomfort with urination. Use this opportunity to remind women to clean the perineum by wiping from front to back. And that's another important concept that I'm going to test you in the exam. Never from back to front. Teach them that the front to back technique keeps organism in stool from coming close to the urethra and decreases the risk for infection. So now here we have the bladder scanner. Okay, we are going to talk about that later, especially when we are going to set up this. Women with some cultures or religions may have undergone female circumcision. This procedure alters the appearance of the vulvar perineal area and increases the risk for urinary tract infections. Okay, it also makes urethral inspection or catheterization difficult. Document any noted anatomic changes and ask the patient to describe hygiene practices for this area. Also, we are going to right now jump into diagnostic assessments. We have the laboratory, the blood test, important to check for serum creatinine. It's produced when muscle and other proteins are broken down. Because protein breakdown is usually constant, the serum creatinine level is a good indicator of kidney function. And I would say is the most important indicator of kidney function. No common pathologic conditions other than kidney disease increases the serum creatinine level. That's why it's the good indicator of kidney function. When the serum creatinine level is double, it indicates a 50% reduction in glomerular filtration rate. And that's good to know. So when the kidneys, with the serum creatinine level is double, it indicates a 50% in reduction in the glomerular filtration rate. That's good to know. Okay. Safety priority, serum creatinine of 0.5 or greater places a patient at risk for acute kidney injury from iodinated contrast media and some drugs. So if the patient is going to go for testing, MRI, CT scan, and the creatinine level is more than 1.5, is something that you don't want to put the patient in that situation, right? Monitor both baselines and trend values to recognize risk for an actual kidney damage, especially among patients exposed to agents that can cause kidney dysfunction. So it's very important to ask for blood reports before those tests. Blood urea nitrogen, BUN, measures the effectiveness of kidney excretion of urea nitrogen, okay, a byproduct of protein breakdown in the liver. Urea nitrogen is produced mostly from liver metabolism and of food sources of protein. So BUN is related to the byproduct of protein breakdown. Creatinine has a relationship with the glomerular filtration rate. Other factors influence the BUN level, and an elevation does not always mean that kidney disease is present, okay? For example, rapid cell destruction from infection, cancer treatments, or steroid therapy may elevate the BUN. Important to know, right? So when we always see BUN elevated, we think about dehydration, but also we have to consider infection, cancer treatment, or steroid therapy. In addition, blood is a protein, so blood in the tissues rather than the blood in vessels is reabsorbed, and if it were a general protein. So that's reabsorbed blood protein is processed by the liver and increases BUN levels. This means that injured tissues can result in increased BUN, okay? So distraction from infection, trauma can increase BUN, dehydration, cancer, steroids, right? In addition, BUN is increased by protein turnover in exercising muscle and is elevated as a result of concentration during dehydration, and we know that, right? BUN to serum creatinine ratio can help determine whether non-kidney related factors such as low cardiac output or red blood cell destruction are causing the elevated BUN. Again, BUN to serum creatinine ratio can help determine whether non-kidney related factors such as low cardiac output or red blood cell destruction are causing the elevated BUN. So when we see the BUN to creatinine is elevated, we have to think about red blood cell destruction. It could be maybe a hemolytic anemia, okay, or low cardiac output. Okay, so that is good to check cardiac function. Urine test, urine analysis, we have to check for urine color. Specific gravity is the concentration of particles, like for example, electrolytes, waste in urine. A high specific gravity indicates concentrated urine from dehydration. Okay, a high specific gravity indicates concentration urine high in because of dehydration, or maybe decreased kidney blood flow, or excess vasopressin associated with stress, surgery, anesthetic agents, or certain drugs like morphine, oral anti-diabetic drugs, right? Or syndrome of inappropriate diuretic hormone. Low specific gravity indicates dilute urine. Low specific gravity indicates dilute urine that may occur from high fluid intake when it's right. That's why it's low specific. There is a lot of fluid and it's diluting a lot. So there is low specific gravity. Diuretic drugs, for example, or diabetes insipidus. Now, specific gravity of urine is compared with distilled water, okay, which has a specific gravity of 1. The normal specific gravity of urine ranges from 1.005 to 1.030. I'm not going to test you on this now. Kidney disease diminishes the concentrating ability of the kidneys, and chronic kidney disease may be associated with a low dilute specific gravity. Again, kidney disease diminishes the concentrated ability of the kidney, and chronic kidney disease may be associated with a low dilute specific gravity. pH is a measure of urine acidity or alkalinity. A pH value less than 7 is acidity. Is acidic, we know that. We saw the video before. And a value greater than 7 is alkaline. We are talking in terms of urine, pH of urine, right? Urine pH is affected by diet, drugs, systemic disturbances, or acid-base balance. and kidney tubular function. For example, a high protein diet produces acidic urine, right? Whereas a high intake of citrus fruit produces alkaline urine. Even a vegetarian is an alkaline diet, right? High in vegetables and fruits. The normal pH of urine ranges from 4.6 to 8 with an average of 6. Now, laboratory profile, I want you to focus on this. On your serum creatinine, know your normal levels of serum creatinine. That's a must know. Your BUN, your urine creatinine ratio, right? Also, you have in your urine analysis your normal range for adults in terms of color, the aroma similar to ammonia in terms of odor. Specific gravity is important. I'm not gonna test you, but you know what? For NCLEX, the specific gravity is going to be important. pH is important. Ketones. Please pay attention to the presence of ketone in urine. Presence occurs with diabetic ketoacidosis, which is more common in diabetes type 1. You're going to study more about this in the next semester. It can happen in diabetes type 2. Also is going to appear with prolonged fasting and anorexia nervosa. The presence of protein also in urine may indicate stress, infection, recent strenuous activity, or glomerular disorders. RBCs increase is normal with catheterization or menses, but may reflect tumor, stones, trauma, glomerular disorders, cystitis, or bleeding disorders. WBCs may indicate an infection or inflammatory in the kidney. Also, crystals presence may indicate that the specimen has been allowed to stand. Now, parasites, presence of trichomonas vaginalis indicates infection, usually of the urethra, prostate, or vagina. Nitrates, presence suggests urinary related to escherichia. Always nitrates relates to escherichia. And leukocyte enterase, presence suggests urinary tract infection. And protein is not normally present in the urine. Microalbumin levels greater than 80 in 24 hours are abnormal. Microalbuminuria is the presence of albumin in the urine that is not measurable by a urine distillate or usual urine analysis procedures. Do you remember in the previous video we were talking about the albumin and microalbuminuria? Specialized assays are used to quickly analyze a freshly voided urine specimen for microscopic levels of albumin. Collection of urine specimens. Important also, voided urine. Collect the first specimen voiding in the morning. This urine is more concentrated in the early morning, and these are different tests that the doctor is going to order. Now we have the clean catch specimen, explain the purpose of the procedure to the patient, correct technique to needed to obtain a valid specimen, right? Catheterization specimen for non-indwelling straight catheter. The one-time passes of urinary catheter may be necessary to obtain an uncontaminated specimen for analysis to measure the volume of residual urine. So here are these different types of collecting of urine specimens. Another one that is important because it's very frequent, especially the 24 urine collection. Instruct the patient thoroughly. A 24 collection of urine is necessary to quantify or calculate the rate of clearance of a particular substances. And then those are the most important, right, that I will ask you to understand and to remember, right? And then let's move into glucose. In the urine may indicate a high level of glucose in the blood, We spoke about that, right? So up to 180, the kidney can reabsorb that glucose. After 180, we're going to see, like typically greater than 220, we're going to see glucose in the urine. Changes in the renal threshold for glucose may occur temporarily in patients who have infection or severe stress. Ketone bodies are formed from the incomplete metabolism of fatty fats. Three types of ketone bodies are acetone, acetoacetic, and beta-hydroxybutyric acid. So most important is to remember that ketones are formed from the incomplete metabolism of fatty fats. Leukosterase is an enzyme found in some white blood cells, especially neutrophils. When the number of these cells increases in the urine or they are damaged, the urine then contains leukosterase. A normal reading is no leukosterase in the urine. So nitrates also are not usually present. Many types of bacteria, when present in the urine, convert nitrates found in urine into nitrites. Then we have the sediment, the CADs. I'm going to skip this. Urine crystals come from mineral salts as a result of diet, drugs, or disease. Common salt crystals are formed from calcium oxalate, and this is the most common form for kidney stones. Urea, phosphate, magnesium, or other substances. Some drugs, such as sulfates, can also form crystals. Bacteria multiply quickly, so the urine specimen must be analyzed promptly to avoid falsely elevated counts of bacterial colonization. And based on the number of bacteria, the doctor is going to order the antibiotic based on the number and based on the type of bacteria. Menstrual blood and toilet tissue also contain the specimen and can invalidate the result, right? So we have to think about that. More laboratory profile in the 24 urine collection, right? They are going to study the creatinine, the urea, the sodium, chloride, calcium. That's for general information. I want you to pay attention to current guidelines suggest that clinical laboratories report an estimate of GFR based on the modification of diet in renal disease. So the modification of diet in renal disease equation does not require urine to estimate the GFR. The calculation requires the serum creatinine, age, and number specific to gender and ethnicity. The calculation is an accurate way to measure urine creatinine clearance. This is good to know, but when you get the report, this information is going to be processed already. So I think here they are talking about the osmolarity. I want to focus on the urea. Is a nitrogenous compound that is the chief nitrogenous end product of the metabolic breakdown of proteins in all mammals and some fishes, and we already know that. This is the bedside sonography, bladder scanners. Okay, now let's focus on this. The use of portable ultrasound scanner in the hospital and rehabilitation setting by nurses is a non-invasive method of estimating bladder volume. Bladder scanners are used to screen for post-void residual volumes and determine the need for intermittent catheterization based on the amount of urine in the bladder, rather than the time between catheterization. So before scanning, select the male or female icon on the bladder scanner, and that's good to know. It's coming in the exam. Using the female icon allows the scanner software to subtract the volume of the uterus from any measurement. Use the male icon on all men and on women who have undergone a hysterectomy. That's good to know. You're going to put the male icon on men's, but also on the woman who who have gone a hysterectomy. Let's stop here, and when we come back, we are going to check for imaging assessment. Okay, let me see. Okay, imaging assessment. Yes, we are going to stop here, and when we come back, imaging assessment. Thank you.